Hello, anyone here?
Yes, ma'am.
किटानी ने बोला रिया ने बहुत शॉपिंग किया शीशा के कार्ड पे करके सामान बेचा। वाह, वाह, वाह। रिकॉर्डिंग हो रहा है क्या? रिकॉर्डिंग कहाँ पे है?
रिकॉर्डिंग बाद में होगी।
हैं?
बाद में लेक्चर खत्म होने के बाद ऑटोमेटिक।
तो अभी जो मैंने बात की वो तो-
नहीं हो गई।
हेलो हेलो हेलो, एनीवन हियर?
Yes, ma'am.
हेलो
Yes, ma'am.
हेलो,
Yes, ma'am.
है कि नहीं है?
आवाज आ रही है?
कोई तो बात कर रहा है, दूर से लग रहा है।
Hello, ma'am.
उनका नाम लेके
Yes,
बात
ma'am.
करो। स्टूडेंट का।
हेलो, सूरज इज देयर?
Hello.
एक मिनट, ये वाला काम कर रहे थे।
Yes, ma'am.
हेलो हेलो,
Yes, yes, ma'am.
yeah, what's your name?
Hello.
Hello, what's your name? What's your name?
Suraj Bansode.
Yeah,
Suraj Bansode.
do you belong to third second? Hello,
Yes, ma'am.
do you belong
Yes,
to
ma'am.
third
Third
second,
second
third
batch.
one or final one?
Third second.
Okay, thank you so
Third
much.
first
I wanted to confirm.
winter batch.
Yeah, the thing is your portion is lagging
Second, ma'am.
too much behind. Hello, hello.
Yes, ma'am.
हाँ, आप लोगों का जो पोर्शन है ना बहुत पीछे है, so I will be conducting these classes regularly and third second especially I will be taking, okay, all the lectures because your portion बहुत पीछे है, ठीक है?
Yes, ma'am.
Yes, ma'am.
Okay, we'll continue the radiation biology. I know it's half of it is over, so I don't want to continue with half. So I'm starting from the beginning. Yesterday I've started, continuing further. Effect on the cell replication. We all know that the radiation therapy, when we give in cancer patients, it has an effect on the cell. Basically, the new cells which are being formed, because in that the nucleus is the most sensitive site, and in the nucleus it is the DNA which is mostly affected. Okay, yesterday we saw about chromosome abrasions and this one breakage of the chromosomes. So moving on to the effect on cell replication, radiation to rapidly dividing cell systems will cause a reduction in size. The pool of cells in which they're rapidly dividing, in that if you give radiation therapy, then what happens? Because they are rapidly dividing, it will cause reduction in the cell. Ultimately, the smaller the dose or the larger the dose, but it will affect, and you can see that effect very instantly. Okay, so there's a reduction in size of irradiated tissue as a result of mitotic delay and cell death also. If they are slowly dividing cells, then the result also will be delayed to see. Okay, in the rapidly dividing cell, you will see instant reduction in the size. Then reproductive death, loss of capacity for mitotic division in a cell population. It can't divide further. Okay, that is a reproductive death occurs. The three mechanisms of reproductive death are, so how does the DNA death occurs, or the cell death occurs? That is by either by affecting the DNA, by the bystander effect, and by apoptosis, that is by shedding. We'll see what is the bystander effect. Yeah, coming to the DNA damage, cell death is basically caused by damage to DNA, which in turn causes chromosome aberrations, that is breakage, either in the synthesis phase or in the mitotic phase. If it is in the synthetic phase, both the chains are broken, okay, which cause the cell to die during the first few mitosis after irradiation. It is a rate of the cell replication in various tissues and thus the rate of reproductive death. In a sample of slowly dividing cells, if it is irradiated, then larger doses is needed and longer time intervals are needed to induce the deterministic effect, to see the severity of the effect on the cells. Okay, but if you give in rapidly dividing cells, then lesser dosage is needed and lesser short time is interval, and you'll see instant effect. Coming to the bystander effect. Bystander effect is nothing but the cells that are damaged by radiation, and these release the molecules in the immediate environment, thereby killing the nearby cells. That is the bystander effect. This effect causes chromosome aberrations, cell killing, gene mutations, and carcinogenesis. Okay. Coming to apoptosis we all know since high school, that is the shedding of the cells. It's also known as programmed death cell. They will be shedding of regularly. Okay, occurs during normal embryogenesis. Cells round up, draw away from their neighbors, and they condense the nuclear chromatid. This can be induced in both normal tissue and in some tumors. It is most common in hemopoietic and lymphoid tissues. So how does a cell recover? Cell recovery from DNA damage and by the bystander effect. It involves the enzymatic repair of single strand breaks of DNA. We all know the single strand breaks of DNA can be repaired by copying the normal intact one. But what happens when both the strands are broken? There will not be, there is nothing to copy. Okay, so what happens? They will join itself, they will repair. So that could be a haphazard arrangement, or the sequence may not be followed correctly. So a higher total dose is required to achieve a given degree of cell killing when multiple fractions are used. Especially in radiotherapy, we don't give dosage at one instant. Okay, we give it in fractionated doses. Every 5 days they give one dosage. Okay, so the dosages are divided. So a higher dose is required to achieve a given degree of cell killing. अगर इतना cells kill करना है, so you need a higher degree, especially where multiple fractions are used. If you give in fractionated doses. Okay. Coming to radiosensitivity and cell type, most radiosensitivity cells have the following characteristics. Radiosensitivity मतलब अगर आप cell देखोगे, neurons जो कभी divide नहीं होते, okay, and then you have the erythrocytes which जो जल्दी ये होते हैं, multiply होते हैं, और their life cycle is just for 120 days. So the radiosensitive cells means the one which rapidly increase, I mean जो rapidly divide होते हैं, they are most radio sensitive. And radio resistant कौन सा है जो कभी divide नहीं होते, वो radio resistant है यहाँ पे. Most radio sensitivity cells have following characteristics. They will have a higher mitotic rate, that is the rapid proliferation, and it will undergo many future mitosis, and they are primitive in differentiation. मतलब वो जब नए cells पैदा होते हैं, तो they are not different from the normal cells, the one which are matured. They are almost same. They are primitive in differentiation. Relative radiosensitivity characteristics. If the cell is supposed to be told has high radiosensitive, the high radiosensitive मतलब जो रेडिएशन थेरेपी से सॉरी जो रेडिएशन थेरेपी से काफ़ी सेंसिटिव होते हैं या रेडिएशन देने पे वो इमीडिएट इफेक्ट दिखाते हैं. High radiosensitive are the one which divide regularly. They have got long mitotic figures. They undergo little or no differentiation between mitosis. जब divide होके mitosis होता है तो उसमें cells में कुछ changes नहीं होते. They resemble the primitive cells. Okay, they are said to be intermediate sensitive when they divide occasionally in response to the demand for more cells. जब डिमांड आते हैं, जैसे कि आपको कोई वैस्कुलर इंजरी हुआ है तो वहाँ पे क्लॉट फॉर्म होना है, सो प्लेटलेट्स अडर होते हैं, ये सब होता है. सो इन दैट केस देयर इज अ डिमांड फॉर द सेल्स. दे आर intermediate sensitive. Low sensitivity, they are highly differentiated cells, and when mature are incapable of division. जैसे न्यूरॉन्स है, they don't differentiate or they don't go multiple future differentiations or divisions. The examples of high radiosensitivity include spermatogenic and erythroblastic stem cells, basal cells of the oral mucous membrane. So oral mucous membrane is also sensitive to radiotherapy. Okay, intermediate one. Intermediate radiosensitivity include the vascular endothelial cells, fibroblast, acinar and ductal salivary gland cells, parenchymal cells of liver, kidney, and thyroid. And the low radiosensitivity include neurons, striated mucous membrane cells, squamous epithelium cells and erythrocytes. Okay, just a minute. पानी भी नहीं है यार इधर. Okay, deterministic effects on tissues and organs. Deterministic effects we said, I said in the last class, yesterday 4 बजे को लिया था क्लास. ओके, वहाँ पे ये बोला था जैसे जैसे आप डोज देते जाओगे वैसे वैसे आप सिवियरिटी देखोगे. जैसे जैसे आप डोज बढ़ाते हो the severity also goes on increasing. That is the deterministic effects. Short-term effects on tissues is determined primarily by sensitivity of its parenchymal cells. When continuously proliferating tissues are irradiated, continuous proliferating मतलब rapidly dividing cells. With moderate dose, cells are lost primarily because of the reproductive death. वो मर जाते हैं क्योंकि उनकी क्रोमोसोम सेंसिटिव है, उनकी न्यूक्लियस सेंसिटिव साइट है. So they die by reproductive death or by the bystander effect. They after death they may release the toxins in the environment, killing more cells. And by apoptosis, programmed cell death. That is, they shrink off from the normal mucosa and they shed off. Extent of cell loss depends on the damage to the stem cell pools and proliferative rate of cell population. जहाँ पे proliferation होते हैं, that is stem cell pool, वहाँ पे affect होता है. ठीक है? Effect becomes apparent as a reduction in the number of mature cells that are produced हो रहे हैं, but the effect is not seen. They are not coming into the periphery. जहाँ पे पैदा हो रहे हैं वहीं पे मर रहे हैं. Okay, effect becomes apparent as a reduction in the number of mature cells is affected in the series. Okay, deterministic deterministic effects on tissues and organs. So what happens? This one we saw on the cell, right? Then long-term effects we'll see. Long-term effect results in loss of parenchymal cells and replacement of fibrous connective tissue. Long-term में जो ये cells निकल जाते हैं, continuous death हो जाते हैं, they are replaced with the fibrous connective tissue. This is caused by reproductive death of replicating cells and by damage to the fine vasculature. जो ये organ और tissues में जो cells death हो जाते हैं, तो बाद में the narrow vasculature रहते, even that is being affected. Then the damage to capillaries occurs, leading to narrowing and eventually obliteration of the vascular lumens. For example, समझो कि कहीं पे cancer है, okay? Cancer है, for example, any you can take any salivary gland also. वहाँ पे तुम radiation देते जाओगे, and then you will see the deterministic effect. जैसे जैसे आप radiation देते जाओगे, cells निकलते जाएंगे. First it can be by the reproductive death, then by the bystander effect, then by the apoptosis निकलते जाएंगे. लेकिन इसमें सिर्फ कैंसरस सेल्स अफेक्ट नहीं होते हैं, वहाँ पे आपके जो फाइन वैस्कुलेचर है, जो फाइब्रस टिश्यूज है, जो कैपिलरीज है, उनका भी अफेक्ट होता है. देयर इज डैमेज टू द कैपिलरीज व्हिच लीड्स टू नैरोइंग एंड इवेंचुअली ऑब्लिटरेशन ऑफ द वैस्कुलर लुमेन्स. The parenchymal cells are replaced with the fibrous connective tissue. So जब पेशेंट्स आते हैं ट्रीटमेंट होने के बाद, दे विल हैव दैट, थोड़ा हार्ड रहता है उनका म्यूकस मेम्ब्रेन उस जगह पे जहाँ पे कैंसर का रेडिएशन दिया है. And this damage to the capillaries and the vascular lumens lead to what does the blood does? Blood basically takes oxygen and nutrients to the organs and tissues, and it takes out the waste products outside. So अभी जब blood capillaries vascular lumens obliterate हुआ है, so definitely that is going to hamper the transport of oxygen, nutrients, and the waste product removed from that site is hampered, right? So all these hampering will occur. Thus, both the dividing and the non-dividing parenchymal cells are replaced by fibrous connective tissue, and later it leads to a progressive fibroatrophy of that irradiated tissue. Okay, अगर fibroatrophy नहीं होना है तो उसको क्या करना है, that I will tell later. But complete recovery नहीं होता, लेकिन थोड़ा तो effect रह जाता है. Did you understand? Anyone listening?
Yes, ma'am. Yes, ma'am.
मॉडिफाइंग फैक्टर्स. अभी जो रेडिएशन थेरेपी देते हैं उसमें मॉडिफाइंग फैक्टर्स क्या है, वी हैव टू कीप इन माइंड. जब सैलिवरी ग्लैंड ट्यूमर है तो वी हैव टू ओनली इरेडिएट दैट पार्ट ऑफ द टिश्यू. अगर अब आजू बाजू थोड़ा सा भी एरिया एक्सपोज हो गया, सो दैट विल अननेसेसरली इवन द नॉर्मल टिश्यू विल गो इनटू डैमेज. ओके, सो यू नीड टू कीप इन माइंड दैट पार्ट ओनली शुड बी इरेडिएटेड. The response of the cells, tissues, and organs depends on exposure conditions and the cell environment also. So the modifying factors include the dose, what is a dose given, what is a dose rate given, the oxygen level in the tissues, and the linear energy transfer. Coming to the dose, severity of deterministic damage is dependent on the amount of radiation that is given to the patient. In all individuals, receiving doses above the threshold level, the amount of damage is proportional to the dose. At certain point of irradiation, you don't see the changes. जैसे वो एक threshold level cross हो जाता है, so जैसे जैसे तुम्हारा radiation बढ़ता है, वैसे वैसे तुमको severity भी दिखता है. So in all individuals receiving doses above the threshold level, the amount of damage is proportional to the dose that is given to the patients. Coming to the dose rate. Dose rate indicates the rate of exposure. Exposure to a dose at a higher dose rate. अगर dose rate आप ज़्यादा बढ़ाते हो, it will cause more damage than exposure to the same total dose given at lower dose rate. ये समझ में आया आपको? डोज रेट मतलब फॉर एग्जांपल ये समझो पूरा कैंसर थेरेपी में 30 ग्रे का डोसेज देना है पेशेंट को, ठीक है, 30 ग्रेस देना है. एक पेशेंट को आपने दिया एवरी हर हफ्ते आपने क्या दिया, 2 ग्रेस 2 ग्रेस 2 ग्रेस 2 ग्रेस दिया, और एक पेशेंट को आपने 5 ग्रेस में डिवाइड करके दिया. तो किसका इफेक्ट ज्यादा दिखेगा? द 5 ग्रे का पेशेंट का डोज ज्यादा दिखेगा, बिकॉज द डोज रेट इज 5 ग्रे, whereas other patient will have 2 grays. So 5 grays matlab it is crossing the threshold level somewhere and you are giving. So the exposure to a dose at a high dose rate causes more damage than exposure to the same total dose. भले ही तुम दोनों पेशेंट को 30 ग्रे दे रहे हो, लेकिन एक पेशेंट को डोज रेट है 2 ग्रे और एक पेशेंट को डोज रेट है 5 ग्रे. कि 5 ग्रे वाला पेशेंट थ्रेशोल्ड क्रॉस करके तुम दे रहे हो, तो तुमको सिवियरिटी जो है वो तुमको अच्छी तरह से दिखेगा. लेकिन जो 2 ग्रे का है, यू आर नॉट इवन क्रॉसिंग द थ्रेशोल्ड देयर, तो तुमको इफेक्ट कम दिखता है, तो डैमेज कम होता है. लो डोज रेट अलाउज फॉर अपॉर्चुनिटी टू रिपेयर द डैमेज. सो जो लो डोज रेट है एकदम से डिस्ट्रॉय नहीं होता है, इट अलाउज और इट गिव्स द बॉडी फॉर एन अपॉर्चुनिटी टू रिपेयर द डैमेज. Coming to the oxygen level, the oxygen level in the tissues, oxygen is needed. The radio resistance of many biologic systems increases by a factor of 2 or 3. The radio resistance मतलब जो अगर तुम किसी ट्यूमर को इरेडिएट कर रहे हो, you don't just have a cancerous tissue there, definitely you have normal tissues also there, okay, right? So the radio resistance of many biologic systems increases by a factor of 2 to 3 when exposure is made with reduced oxygen. The cell damage in the presence of oxygen is related to formation of hydrogen peroxide and hydroperoxyl free radicals. कल मैंने बताया रेडियोलाइसिस ऑफ वाटर, 90% ऑफ द ऑर्गेनिज्म कंटेन्स वाटर, और इसमें क्या होता है, जब वाटर रहता है तो वाटर इरेडिएशन फर्स्ट अफेक्ट्स द वाटर लीडिंग टू हाइड्रोलाइसिस ऑफ वाटर causing hydrogen hydroperoxyl hydrogen peroxide free radicals. These will cause the damage in the cells, okay, and this damage in the presence of oxygen is related to formation of these products or free radicals. It is important because hyperbaric oxygen therapy that is given may be used during radiation therapy of tumors having hypoxic cell. जिस tumors में hypoxia है उसमें हाइपोबेरिक ऑक्सीजन देते हैं ताकि इस ऑक्सीजन की वजह से फ्री रेडिकल्स फॉर्म हो जाए एंड देन द सेल डैमेज कैन अकर. क्योंकि अगर ट्यूमर्स में ऑक्सीजन नहीं है तो दे बिकम रेडियो रेजिस्टेंट. जो फर्स्ट सेंटेंस है आप देखो, द रेडियो रेजिस्टेंस ऑफ मेनी बायोलॉजिक सिस्टम, इट कुड इंक्लूड ए ट्यूमर आल्सो, इंक्रीजेस बाय फैक्टर ऑफ 2 to 3 व्हेन एक्सपोजर इज मेड विथ रिड्यूस्ड ऑक्सीजन. सो ऑक्सीजन चाहिए इसलिए हाइपोबेरिक ऑक्सीजन दे सकते हैं. Coming to linear energy transfer, the dose required to produce a certain biologic effect is reduced as the LET of the radiation is increased. जो radiation देते हैं उसका एक factor रहता है, that's the linear energy transfer. Okay, the dose required to produce a certain biologic effect अगर उसे एक्टिव करना है is reduced as the LET of the radiation is increased, so it's inversely proportional. Thus, higher LET radiations are more efficient in damaging biological systems because of their higher ionization density is more likely than X-rays to induce a double standard breakage in DNA. Low LET radiation such as X-rays just जैसे X-rays है हमारे IOP X-rays है, they deposit the energy in the absorber and thus are more likely to cause single strand breakage and less biologic damage. Okay, तो इसीलिए आपको higher LET के radiations use करना है. रेडियोथेरेपी इन द ओरल कैविटी. सो जब रेडियोथेरेपी देते हैं तो ओरल कैविटी में स्पेशली क्या क्या इफेक्ट्स दिखते हैं. ओके, इफेक्ट्स ऑन द ओरल टिश्यूज, ओरल म्यूकस मेम्ब्रेन you have taste buds, then you have salivary glands, teeth, radiation carries, bone and musculature. And in the third categories we study this. The rationale behind this is fractionation of the doses of the total X-ray dose given into multiple small doses provides greater tumor destruction than is possible with a larger single dose. एक single dose दोगे तो इतना इफेक्ट नहीं आएगा, अगर आप fractionation करके दोगे तो उसका ट्यूमर डिस्ट्रक्शन ज़्यादा अच्छी तरीके से होता है. फ्रैक्शनेशन, ये जो फ्रैक्शनेशन करते हैं सिर्फ उसके लिए नहीं है, और भी है. Fractionation allows for increased cellular repair of the normal tissues. जो सिर्फ ट्यूमर सेल्स नहीं है, उसके बाजू में जो नॉर्मल टिश्यूज है उसका सेल्यूलर रिपेयर भी होता है फ्रैक्शनेशन देने से. एंड इट अलाउज फॉर इंक्रीजिंग द मीन ऑक्सीजन टेंशन इन इरेडिएटेड ट्यूमर. और आप ट्यूमर में ज़्यादा ऑक्सीजन टेंशन भी बढ़ा रहे हो, रेंडरिंग द ट्यूमर सेल्स रेडियो सेंसिटिव for damage, and you are allowing the cellular repair of the normal tissues which are beside the cancerous tissues. This results in killing the rapidly dividing tumor cells. Tumor cells are rapidly dividing, right? So it will kill the rapidly dividing cells and shrinkage of the tumor mass, that is cell apoptosis after first fractions, reducing the distance that oxygen, अगर जैसे वो shrink होता है तो oxygen पूरा travel करके जो जाता है अंदर तक, उसका distance भी कम हो जाता है. Reducing the distance that oxygen must diffuse from fine vasculature through tumor to reach the remaining viable tumor cells. इसका distance travel करना भी कम हो जाता है. ठीक है. So this is the rationale behind fractionation of the irradiation. Effect on oral mucous membrane. The oral mucous membrane basically contains a basal layer of rapidly dividing radiosensitive stem cells that we all know. Near the end of the second week of therapy, जैसे खत्म होता है, all has some cells die. Mucous membranes, so clinically कैसे दिखता है? Mucous membranes begins to show areas of redness and inflammation. As the therapy continues, mucous membrane begins to separate from the underlying connective tissue with तो mucous membrane जो है वो separate होने को चालू होता है with formation of white to yellow pseudomembrane. At the end of therapy, जैसे जैसे therapy खत्म होता है, mucositis is more severe, discomfort is at the maximum for the patient and food intake is very difficult for the patient. Topical anesthetics will be given, may be required at meal time. Complication is secondary, complication is candidiasis. Okay. After irradiation is complete, mucosa begins to heal rapidly. Healing is usually complete by about 2 months. Later, mucous membrane tends to become atrophic, thin, relatively avascular. This long-term atrophy results from progressive obliteration of the fine vasculature and fibrosis of the underlying connective tissue, as I said previously. Okay, these changes complicate the denture wearing because they cause oral ulcerations of compromised tissues. Taste buds. Taste buds are sensitive to radiation. Therapeutic dose cause extensive degeneration of the histologic architecture of taste buds. Patients often notice a loss of taste acuity. Patients often notice a loss of the taste sensation or the acuity during the second or third week of radiotherapy. Bitter and acid flavors are more severely affected when posterior two-thirds of the tongue is irradiated. वहाँ पे bitter और acid जो है, they are first affected or severely affected. Salt and sweet is lost when anterior one-third of the tongue is irradiated. Taste acuity decreases by a factor of 1,000 to 10,000 during the radiation course. Taste loss is reversible and it will take recovery takes about 60 to 120 days. Coming to salivary glands, parenchymal component of salivary gland is radiosensitive. A marked and progressive loss of salivary secretion is usually seen in the first few weeks after initiation of radiotherapy. Extent of reduced flow is dose dependent and reaches zero at 60 degree. Mouth becomes dry, tender, swallowing becomes difficult, painful. Patients with irradiation of both glands are more likely to complain of dry mouth and difficulty with chewing and swallowing. We all know that saliva helps with formation of the bolus and also helps with desensitization. When they are irradiated, then you will have dry mouth, difficulty with chewing, swallowing, everything. Serous cells are more radiosensitive than mucous cells, and residual saliva, what is there, that is very viscous. Come here, so it is viscous. The saliva has a reduced pH here, 1 unit less, though it means it becomes more acidic or acidic is sufficient to cause decalcification, that is causing caries. Buffering capacity also falls as much as 44%. If some portions of salivary glands are spared, then dryness usually subsides in 6 to 12 months because of the compensatory hypertrophy of the salivary gland tissues. In months later, inflammatory response becomes chronic and glands demonstrate progressive fibrosis, deposition of the fat, loss of fine vasculature, and concomitant parenchymal degeneration also. Coming to the teeth, we all know that you have radiation caries here. Children are subjected to radiation therapy may show defects in permanent dentition such as retarded tooth development, dog teeth. अगर छोटे बच्चे हैं और उनमें teeth development अभी तक हो रहा है permanent teeth, then you will see on retarded tooth development, the dog teeth, failure to form one or more teeth. If exposure precedes the calcification, then irradiation may destroy the tooth, but absolutely, okay. Irradiation after calcification has begun may inhibit the cellular differentiation, causing malformation and arresting normal growth. So it depends at what phase the patient is being given radiation therapy, especially in children. Okay, very younger age, the tooth may not be formed or it will completely destroy. If begin calcification, then malformations can occur. If later, not much. It may be even caries. Eruptive mechanisms is totally radio resistant. The eruption of the teeth is completely radio resistant. It is not affected. Coming to radiation caries, that is in a full blown, the teeth are developed, they are erupted, and now you have given radiation therapy. What happens? It is that here your saliva is processing capacity has decreased, saliva has decreased, saliva has become more mucus, more viscous, okay, and it has become a bit acidic by 1 pH. So now, what all you can expect? You can expect decalcification on its normal by saliva also. It's a rapid form of dental decay. Patients receiving radiotherapy show astrogenic saliva and plaque and show an increase in the streptococcus mutans, lactobacillus, and candida. Caries is due to reduced salivary flow, decreased pH, reduced buffering capacity, increased viscosity, and ultimately the microbial flora is also altered because of the pH. Reduced saliva has. Hello? Hello? Hello,
Yes.
anyone? Anyone has any problem?
No.
Okay. Reduced saliva has a low concentration of calcium